Hello to all OMG podcast listeners. Today we have a very special guest on our show. It's our esteemed Datuk Dr Ameen Shaik, the very founder and director of Polyclinic Al Shaik Group. And today we're going to talk about how his personal life, how his pivotal moment that leads to his entrepreneurship journey, and a lot that we want to learn from his experience and whatnot. So, without further ado, let's start the discussion. So, Datuk, back in 1994, you did your housemanship in India.
Yeah.
Tell me about it. What was your life?
Well, Assalamualaikum, Aizat. Thank you for inviting for this podcast. Actually, my actual ambition is not to become a doctor. My actual ambition is to be a pilot. And even until today, I'm very excited when I get into the aircraft.
Okay.
I can't sleep one day before I fly anywhere. And I've learned so much about plane. And so one fine day, I went and told my dad, I want to be a pilot. And being in this family, the occupation that they always look into last time is lawyers, doctors, engineers. These are the three things. So my father told me to do medicine. So medicine was not my choice at all, not at all. So because to fulfill my father's wish, where he is unable to do at his time due to financial problem, at work and do. So he told me to take up medicine. Then I went to India. So I went to India in 1986. And we did, at that time, we did what we call pre-university, PUC. So PUC 1 and PUC 2. It's sometimes macam pre-medic lah, pre-medic. Lepas tu you go into medical school. So when you go into medical school, at that point of time in Manipal, I studied in Manipal. It is 4.5 years course. Then after that, you have to do 1 year of housemanship. So housemanship to be done in India. Yeah, but that housemanship is not recognized in Malaysia. You come back, you still have to apply for housemanship, and you do the housemanship in Malaysia, then followed by the MOs and all those things. That's the cycle. But my journey in India was very good. We spent almost 8 years.
8 years,
yeah, 5, 6, 7, almost 8 years kat situ. It was a very nice experience being in overseas, and of course in India you see all kind of cases. Cadaver is not a problem. In an anatomy hall, cadaver is not a problem. When we first enter into the anatomy dissection hall with formalin there, the new students, you will have eye burning, teary eye, lepas tu susah nak nafas lah, bermacam-macam kan. And then bila dia bawa, the body pun itulah bertimbun one above the other. One above the other. And the first one that we got for my table is without the head, because the first one we learned upper limb is the first, and the thorax. So upper limb, so we just got a cadaver without the head and without the legs, and with the bangle. It's so scary. But then after that we got used to it, and we did this section every day, and alhamdulillah, everything went on well. Then after that, different subjects, and you go into hospital, your clinical and training and all that. Yeah, we've completed very nice. I think that's the best. Being a student, that's the best environment.
Okay.
You don't get that kind of environment. You don't get that kind of friends. But because after that, it's from all over the world. They come and study there. Of course, majority of them are from India as well. But the friends that you have over there, after that, they are all big surgeons and specialists all around the world. I've got a lot of friends in America, UK, India, a lot of Middle East. We start there, and today they are all somebody big.
Yeah. So you start off your housemanship training in India.
Yes.
Then you have to return back to Malaysia.
Yeah.
So when you compare the difference between two places of working place.
Well, in India is a teaching hospital.
Okay.
Yeah, it's a teaching hospital. The houseman there is not like the houseman here. Yeah, the houseman there is very much relaxed. You have got you medical students there. You've got the PG postgraduate students, and you don't do much actually. It's not like something like Malaysia.
Okay.
Malaysia is very intense. So when you come to Malaysia, it is very very intense. The housemanship here is really you really work here.
It's crazy, right?
Every doctors know that. Until today, they're still working. There's no change from 20 years, 20, 25 years ago until now. It's still the same. It's very intense, and that is the best experience that you can gain during the internship in Malaysia. If you want to learn, that's the place. That's the time. That's the time. You can do all kind of things. You can get all kind of scoldings.
Yep.
Even until now, you get
Yep.
all kind of scoldings, and everything is an opportunity. You learn how to put in a line, you put in a catheter, you put in a Ryle's tube, and all those things. I've made a lot of mistakes.
Yeah.
Everybody make mistakes during housemanship, and one of the mistakes that I made is putting in a catheter, and the catheter was not complete. The catheter, I put in a catheter, and I was turning, and because of the KY jelly, the catheter came out, and I went and inflate. It was not at the right position. And the patient unable to pass urine. The patient came back later in the evening unable to pass urine, and it was a big issue in the hospital. They found out who is the houseman who did this, and I learned. And after the mistake, until today how to insert a catheter properly. You learn from the mistake. And I think housemanship training in Malaysia is good, but it's very intense, sleepless nights, and not only houseman, you go to MO pun sama juga. Sleepless nights, you have to work, but that's the best training ground. To be a good doctor, that's the best training ground lah. You learn everything, and if you are more proactive, you can get into OT, you can do your appendix, simple surgeries, lumps and bumps, some CMR. A lot of things that we can do, and I think our Malaysian housemanship training is good, provided you have to be strong.
Yeah, exactly. But which hospital were you at that time, Datuk?
I was in University Hospital.
Okay.
I was quite lucky. I was staying in Subang and managed to get hospital university at that time, and at that time traffic was not very bad.
Not that really bad.
We can just go. Within 20-25 minutes, we are there. But of course, lepas subuh kena pergi lah. Lepas subuh, and then you have to be there, and you have to check all the patients and all those things. I did my housemanship in UH. Lepas tu MO, I went to KLGH lah. MO was in KLGH.
So people always talk about this GH hospital as very extensive in terms of patient load. What's your experience at that time?
Well, yes, it is extensive. Until today, it's still extensive. It's getting more and more. But when we are young, we want to learn. We want to learn. More the patient, the more you learn. If you don't have patience and this thing, you don't learn much. So having a lot of patience and treating them in a various problem and this thing, it's a good exposure to any doctors, and that's the best place to learn actually.
So I did my housemanship also in HKL, but at that particular time, we have total of I think 20 housemen per posting. I think more. What was your ratio at that time?
Okay, ours will be about, in a ward, we have about maybe 4 to 5 in a ward. 4 to 5 in a ward.
And how many patients per ward at that time?
I can't remember, but the ward is always full.
Yeah, it's
the
always
whole
full,
ward
right?
is always
Extension,
yes,
those things.
it's always full. 4 to 5. And in UH, in UH we have to give IV drug by ourselves. Yes. It's not like matam any other hospitals in other GH, the nurses yang bagi IV. But in UH, I think until today they still practice the same thing. The houseman have to give all the IV drugs. So if it's TDS ke QID ke, it's you lah. You are responsible for the whole thing. So you have to go to there's a prep room and you prepare all the medications and you have to write the bed number, and then you have to go and ask whether this is the patient, and then you have to give IV drugs to. And then bila you bagi IV drugs, suddenly sangkut pula.
Then you have to
set line. And some patients are not easy to set lines. It's so difficult to set lines. So these are the things in UH. But in GH, no. In GH, the IV drugs, the nurses give the IV drugs.
So you mentioned earlier about your family, that your dad once actually persuade you to do medicine. Can you share with us about their background?
Oh, my father, his education level is up to MCE Form 5, Form 5 level. He's unable to continue. His grades are good, but unable to continue because of financial, my grandfather didn't have enough money. So my father started working at after Form 5. So he was working in Penang. We are from Penang. He was in one of the Detailum in Penang. Then after that, he got transferred here. And then his final position was a warehouse manager. So he was a warehouse, in charge of a warehouse. He was a warehouse manager. My mother is a housewife.
Okay.
My mother is a housewife. My father died at 1991. So at that time, I was about 22 years old. Still doing medicine. So he wanted me to become a doctor. But unfortunately, he did not see me graduating. My brother is also a doctor. So my second brother is also a doctor. So he did not see us,
The children,
see
graduates.
us as a graduate. But my mother has, she's a housewife, but she has made all of us graduate. All five of us are graduate today.
Wow. So when you talk about doing medicine part of your family's direction, was it tough?
As I told you, pilot was the thing.
Yeah.
But when I went to India and started studying, there was an interest. So it was not like macam kena force.
Yeah.
Nowadays kena force, they actually just do for the sake for the parents, and after that they go back. Alhamdulillah, in my case, I liked it. I enjoyed it, and I pursue the whole thing. Of course, in medicine, if you don't fail, you are not a good doctor.
Yeah.
Not to say you will fail somehow.
Fail is common in
Fail
medicine.
is common.
Fail is common.
And it's not like all the students will get first class or distinction or whatsoever. But I failed in my physiology. And because of that, I failed in 1 mark. So because of this, I had to repeat 6 months. We over there, if you fail in first year and also in final year, you cannot you have to repeat.
Okay.
You have this 6 months extension. So I failed, and I just did physio for 6 months. And good thing is, after that only I know how to study medicine. Before that, I was I do not know how actually to study for it. You see, but during the failure, we had a lot of time. And that's where we apply a lot of, rather than memorizing, you tend to apply the thing into your daily other subjects and all those things. So failure is actually good for me. I failed and I learned. And after that was passed throughout. And after that, I was getting first class in all until final year. Final year, I think in my university, 5 of us got first class, and I'm one of them who got the first class for final year exams.
So you talk about you finally understand how to study medicine.
Yes.
Right.
Yes.
So let's dig in detail on that. What do you mean by understand or study medicine? Because I think last time when I went to medical school, it's all about memorizing.
Correct.
Right.
Yes,
Memorizing
yes,
and regurgitating.
Correct. Yes. Yes.
How is it different with our method?
Because that's what we all thought, memorizing the whole thing, and then we just, at the exam time, we just write. But applying it, the physio, you study physio or you study anatomy, but later on when you study orthopedics or something, then you apply that thing, the nerve, where it goes, and you're coming to that, and same thing with physio or biochemistry. Biochemistry is so dry. Biochemistry is so dry.
Purely facts.
But then you come later, you talk about digestion and all this, so you apply this thing. Oh, this is how it works, But I see now in some of the university, they have everything together right now. It's not like how it was last time. They have everything together. So the current students, they understand better. They have the anatomy, physio, and then they have a bit of orthopedics or what. They understand everything much better compared to last time. So by understanding, it will be there all the time, rather than you are mugging it out and just letting it. And after that, you tend to forget the whole thing. So that actually helps me by failure. After that, understanding it and applying it. Then after that, you can remember until today. What you studied 20 years, or 20 more than that, and 30 years, you can still remember that thing.
I think this you talk about the way curriculum changed, right?
Correct,
I was
yes.
the batch whereby they implement the mixture of pre-clinical and clinical content.
Correct, yes,
So they
yes.
call it the anatomy, physio, and pathology. I mean, all the pre-clinical subjects they combine with clinical.
Correct, yes,
And
yes.
tend to make sure the student understand better.
Yes, yes.
But I figured actually the teacher the one that's actually make it easier to understand.
Correct, yeah.
What do you think about your
Definitely.
time
If you have a good lecturer, you will understand better. If the lecturer is very boring, or he do not know how to relate and this thing, then you probably lose interest in that particular subject. Of course, the lecturer plays a lot of importance now. But nowadays, beside if the students don't like this, YouTube for you to go to another this thing, and then they can just see the lecture on the other places and all those kind of
nowadays, right?
yeah.
Do you have any key figures in your early life?
Early life, I don't have any key figures. Nothing. Early life, early life, I am just a simple nothing. I'm basically nothing. Just a normal student. I've got interest in cars. That's all. Interest in cars. So I will put a Mercedes Benz car at the side, a poster, and I will tell myself one day I have to own this car. That's the only thing I have. I don't have any key figure at that point of time because I was young. And that time, you don't have all the social media and all those things, you see. Now you have social media. Now you got a lot of things. The young students have got a lot of things, they can look into a lot of things. Unfortunately, my time, there's nothing beside study and there's nothing much. Not much of entertainment. When you're overseas in India, kita pergi ke uni, balik, tidur sekejap, lepas tu start studying, medicine tahulah, kalau kita miss satu hari yang kedua dah berlambat dah, susah syllabus dia kan banyak. So we got nothing, not much of this thing. Computers pun tak ada, everything is textbook. But today I don't see students carrying textbook. Everything is in iPad, everything is there already, But our time is textbook, underlining, markers, and all those things. So time has changed. It has evolved into much easier right now.
So if you recall back during your early days, who actually gave you the extra pushing factor for you to be a
I think the pushing extra factor for me is the death of my father. My father's death actually inspired me to be more responsible. I being the eldest in the family, I still remember 3 days before he passed away, he called, and he told me, come back fast, study hard, and come back fast, and you have to take care of the family. This is the final word that he actually told me. But I didn't know that's going to be the last thing. But that was the inspiration. My father's word was my main inspiration for me to finish as fast as possible and to come back and take care of the family.
Wow. That's inspiring. Were you always academically inclined during your early days until your medicine days?
Yes. Yeah. I was more in my room, always studying. And then, when we went into medicine, it became a little bit more tough and more time being spent. We do play games, but not like my brothers. My other two brothers are very active in football. They are very active in football. I'm not, but I just watch and I just play around. We play badminton and all those things, but not much. But academically, yes, I was involved a lot. It is all this before that, yes, but lepas tu it was my father's death lah. Yang really pushed me. Nothing, I have to finish. I can't afford to fail anymore. I have to come back. Finance was also another thing. We were studying based on my father's EPF money and also my father's insurance money. And my mother has to educate the rest as well. So I have to make sure I have to finish and come back
within time.
There's
no scholarship at that time, Datuk?
No scholarship. It was by my father.
Okay. So after you finished your training, at one point of time, you decided your dream is to be an orthopedic surgeon.
Yes. Yeah.
Let's talk about that, Datuk.
Orthopedics has always been my inspiration. I wanted to be an orthopedic surgeon. I used to be good during first year we study about osteology. So I will memorize all the bone insertion,
Wow.
everything I know. And yeah, so when I was doing my housemanship, I was actually looking forward to go to the orthopedic department. Finally went into orthopedic department, enjoyed. Then lepas tu kan kena pergi ke different hospital
rotation.
to GH. So I went to GH, KL. So I asked for ortho. Ortho was full, and they put me into surgery, and I didn't like surgery at all.
Okay.
I somehow want to go to orthopedics, but anyway, the pengarah told me there's no place, you have to go to surgery. Okay, I just went. Then I was there for about 6 months. Then I went back to the pengarah and I told pengarah, please give me orthopedics. I need to go into orthopedics. So he saw me coming, second time, and before that point I pernah tanya dia. Then finally he allowed me and I went into ortho. Then after in ortho for a couple of years, then I applied for master's program and I got into the master's program. But unfortunately, the first part of the master's program, after my fourth attempt, I failed. And after you fail, you can't this thing. So I have to leave the university after this thing.
When we talk about the first part, is the theory.
Correct.
Part,
the theoretical part, yeah.
What was the challenges at that time?
Oh, it was probably back to the same thing again, that I didn't know how to to actually study and the approach and all those things. And furthermore, I was in KLGH and it was very, very busy. So time to study pun is very limited kan? Very limited. It's not like undergraduate, it's easy, you've got nothing to do. But here, you kena kerja, letih, and then you have to study
some more.
and all those things. So that was probably, I cannot cope on all those things. And I didn't understand really well the format and all those things, because it was different from the Indian system, and here it's totally a different thing. So that was a bit tough at that for me.
So the moment when you realized that your dream of becoming an orthopedic surgeon enabled to materialize, what was going through your mind?
At the fourth attempt, I really worked hard at the fourth attempt. I thought I will pass the fourth attempt. Then we went for the exam, and I got to know I failed at the fourth attempt, and I was down actually. I was very down. I was depressed, very down, because that was my dream, and I could not make it. So I was very down, and I drank a lot of coffee at that point of time, and I even had arrhythmia at that time, cardiac arrhythmia. So I was admitted in the hospital to revert back.
Overdose of caffeine.
Yes. I was really very down, because that was my dream. That was my dream. But we just plan, but God is the best planner. If I don't fail in orthopedics, I don't think what I am today.
Yep.
So I think God's plan was perfect. I failed there, and He has given me something else. Yeah.
I'd like to know further when the fact that it caused you to be a bit depressed and affect you emotionally. Did you experience a loss of identity at that time?
Yes, definitely.
Yeah.
Definitely. You feel down, and you feel very inferior. You feel, when you fail and you go back to GH and all your friends have already passed, and you are just a normal MO, something you are not recognized, nothing. And then when you go to OT pun, the nurses are more, they communicate more towards them, less towards you. Although not, but you feel that you are already a bit inferior, you're worthless, and that kind of feeling will automatically will come. So I felt all those things at that time.
Will you feel like giving up at that time?
Yes, I thought, okay, that's enough with GH, because there's no progress for us when you already buat dah macam tu dah. There's no future for you. There's no point being there.
Yep.
There's nothing to encourage you ke apa ke. You are just going to do work.
Yeah.
But there's no future for you. So definitely I felt very down, and I felt no point working in GH. And at that point of time, also, one of the orthopedic surgeon that I know outside, he actually wanted an assistant for him. So he actually called me to resign and come and join him at the hospital to help him around in the OTs and all this. I was very excited. Okay, at least, and I thought I will try for FRCS as well. FRCS, because pada masa tu ada FRCS as well. So I just before resigning, I wanted to sign up for FRCS. And that's the final. There's no more FRCS after that. Then they changed to MRCS.
Okay.
MRCS, its system was completely different. You know, you have different parts, and it was not recognized in Malaysia. So I couldn't do FRCS. So I resigned, and I wanted to join him. So when I resigned and was going towards him, he passed away.
Oh.
He passed away. So I'm lost again.
Okay.
I'm lost again. I cannot join him. And I don't know what to do. But then the hospital said, "No man, you just come. We will try to get another opportunity. You try to." But I didn't feel good, you know. You are just plain MBBS, and you are not a specialist or whatsoever. So I thought, okay, now I just work with the hospital for a while. So I worked in the hospital, and you know the hospital was not doing well, and I did not get my pay for about 4 to 6 months, you know. And I can still survive because in the hospital the pay was different, but when it comes to private, the pay was 3 times more, so 2 to 3 times more. So I had enough savings. So I could manage. But then it was getting more and more. They will pay a bit, and then they'll pay a bit, and they'll say they'll pay the rest. So they will kind of play psychology. Okay, then you thought it'll be coming. So this thing. And after that, then I decided to go for Umrah. And I think that was an eye opener for me. I went for Umrah.
So the decision for Umrah, what was the, I mean, you want to go for Umrah? Is there any reason for it at that time?
Okay, one is financially I was not that good. I only had to be honest, I only had about 2,000
ringgit.
After I pay for my Umrah at that time tu tak banyak pun. I think kurang daripada 5,000. This I'm talking about 2002. That was my first Umrah. So I paid for that because I was so depressed with this, and I don't have a proper place to work. And then my wife is also expecting with our second child. And I thought, okay lah, tak apa, at least go for Umrah and come back. So I paid, and I only had about 1,000 plus, and I told my wife, this is the money that we have, and this is for the car and this thing. After I come back from Umrah, I'll work and get more lah with locums and all those things kan. So bila I pergi Umrah kat situ, bila lepas buat tawaf, in front of Multazam, I was there, sedang minta doa, then I received a call telling the hospital closed down. And I've got no job. And I know the hospital closed down. I got this, I can still remember in front of Multazam, I was just sitting for prayer, and I got a call, and they said hospital already closed down already. So I know that when I come back, I got no place to work. I have to look for a place. So that is actually a big thing. And I asked, doa kat situ lah, whatever this thing is, you help me when I come back. So that's I came back. Then after that, it's a different story altogether.
How does your life change after you come back?
Okay, after I come back, I was going to Klang actually. After I come back, I was going to Klang, and Klang pun is another hospital. I went there to actually collect my money, local money, which is not being paid by the doctor.
The doctor.
The doctor. So he told all the stories, and he says, you come back. At that time I was getting bullied. And we are still nice. We do not know about this outside world, because we are in the hospital most of the time. Our friends are all doctors, you see. We don't have friends outside, different job whatsoever. So I didn't get anything. I came back. I was coming back. I was taking Kesas Highway. Kesas Highway. Then I saw this road going into Kota Kemuning. So I thought, okay, why don't just go and see Kota Kemuning? What's this Kota Kemuning all about? So I went in, and I saw a place. They cordoned the thing and they put McDonald's opening soon. Then I went in and I went to this place or row of shop houses, and kat situ ada pasar tani kat situ. And orang yang jual pasar tani, I kenal dia because he also buat di Subang. So I asked this guy, why y'all kat sini? Pasar tani. Then he told me they want to bring the crowd here because this place tak ada crowd, tak ada siapa datang. They want to bring the crowd here. Then I was thinking, McDonald's kat sini, here, then the chances of the crowd coming there is very, very high when the McDonald's open. Then I thought, okay, why? Then I went there 2-3 kali, pergi tengok tempat tu, see whether okay ke apa. Then only finally I decided, okay, this looks quite okay. Why don't we open a clinic kat situ lah.
I like to know more on the decision making on opening a clinic, because if you talk about business choices, right? There's restaurant, F&Bs, there's other options. But what makes you decide GP is the clinic is the decision?
Yeah, because one is, we are doctors, we are doctors, this thing. Another thing is at that point of time, I don't know what to do. The only thing, everybody come out from the government, they open clinic.
GP.
GP clinic at that point of time. Everybody will open one GP clinic. So you will see some of your friends open in this area and some other areas macam tu. And I thought, okay lah, I think I have to, settle down with this thing. So I thought, okay, why don't I start in Kota Kemuning? And Kota Kemuning pun time tu is developing. It just started developing. And there are already 3 clinics kat situ dah. The 3 clinics. So mine was the 4th clinic over in Kota Kemuning, 4th clinic. And people are moving in, young families are moving in and all those things. So I thought, okay, I think I have to put a stop on everything and I have to start this GP clinic. That's how I started my...
Who was the big clinic chain at that time?
Oh, at that time, this Mediveron and Ala Medic.
Mediveron and Ala Medic
lah. They are everywhere. You will see them at that time lah. They were already in Kota Kemuning pun. Ala Medic was already in Kota, but it was in a different area. So I opened in another area. But I have to be different from them. If I just open the clinic same like them, nothing much. So what I did, the first thing that I did is I made 24 hours clinic. So my clinic is the first 24-hour clinic in Kota Kemuning at that time. And it is not easy. It's very, very tough being a 24-hour clinic. You don't have enough money. You cannot employ locum. And you have to work for 24 hours, 7 days a week. So that's how I work. I put a small bilik kat belakang. I tidur di bilik tu. I ada astro kat situ, and my wife just delivered and they stay in Subang. So clinic pada masa tu is not very busy, so I can still afford to go to Subang for a while
and then come
see
back.
them and then come back to the clinic and sleep in the clinic. The Kesas pun was
not busy
like what it is now. So that's how I started. And also I brought in a lot of equipments lah. At that time pun tak banyak klinik ada X-ray semua. So I brought in X-ray, I brought in ultrasound. Then slowly I put in a lot of other machines and all those things.
So when you first started off, do you seek advice for anyone?
Actually, no.
No.
Actually, no. I was like, because of my failure in orthopedics, I want to prove that look, a GP also can be somebody. I had that kind of
mission.
Pushing factor, and I worked very hard. I worked extremely hard. I worked, and when I talk to my doctors today, my company doctors, I said, you have not seen me 20 over years ago, how I worked and how are you all working right now. I worked very hard. The clinic is not busy. I will see patients, and after that I'll take my car and I'll go to the industry area and I give my card to them, And I know the HR will be there. Then the HR say, no, the HR is not here. I've been pushed away at the security guard itself. And when you go in, get bullied by the HR. I still remember one chap actually, he called me in. I think for entertainment purpose, he used me as kind of entertainment. He scolded me and he asked me, why are you opening a clinic here?
Oh.
What's the purpose of you opening? There are already clinics here. Why? All kind of questions. And I felt very bad. But it was a learning process for me. I don't know how to talk to them. I do not know how to talk to them, and I just listen. And I do not know how to smile. The face look macam angry. Macam tu kan when they scold. But this guy, after that, he wrote a letter to me and he gave me the panel.
Oh.
He just he gave me the panel. And this guy, after so many years, I'm still seeing him. I'm the one who actually diagnosed breast cancer for his wife. His wife passed away, unfortunately. But he loves me so much, But I can still remember when I was young how he scolded me, and then after that he gave me the panel. It's a Chinese chap, a very nice guy. And I can still remember his name. His name is, it's a very nice guy. But it was a learning process.
Okay.
It was a learning process. Then I go to the Gamuda was the developer there. Then we went and saw the Gamuda punya HR. The Gamuda HR, it was there, a Pakistani man, and we gave our card. He never smiled, and he was talking to us. Very strict, very strict. He was talking to us, and he asked what are the facilities that we have, everything. Okay, then he just say okay. Then we walked out. Then after a week, we got a letter from them, panel approved, panel approved. And same thing like Proton, there was a doctor, he just passed away already. He came to our place and he inspected the clinic, everything. So I asked him, doctor, macam mana boleh dapat ke? He look at me, macam muka garang, he look at me. And then, tengoklah macam mana.
Oh.
Then he walked off. Then after a week, we got a letter from Proton telling it's approved. But it was a learning, everything is a learning curve for me, But I really worked very hard, worked extremely hard to get all the panels. And today we have all the panels, all the GLCs are under us. Tenaga, Telecom, almost everybody lah is under
So
others.
that time, Dato', the go-to-market strategy or strategy to acquire patient was through panel. Does anyone give you this idea, or you figure it out by yourself?
No, nobody. I was very quiet. I don't mix around with anybody. I'll do it all by myself, and I will map out where to go today. Today I have to cover this company. Then I will list out all the companies. Last time we have yellow pages and all those things. You look at yellow pages and get this thing. All the companies list out. The person pergi one by one. Nobody actually
guide you.
Yeah. Now I was working in before open on and off. I used to do locum in clinics, so I know what are the panels that clinic has. But they are not near to my place. They are all very far to my place. But I know these are the panels, the big companies. So I approach from what I've seen in the other clinics lah.
So when you start to secure one panel, is this the time when you feel like, okay, I think I got it right?
Yes, yeah, definitely. You feel excited, particularly when you get the big companies. When Proton come, and the letter, you feel very excited. This is given. Then after that, Telecom gives you, Tenaga National, the bigger companies come. You feel very excited. Some companies like Tenaga National, I waited 9 years.
No.
9 years.
Nine
I waited.
years,
The 10th year, I got Tenaga National. It's not easy. I waited, I applied, and keep on applying, failure, tak apa. Then we get that particular thing. But it is, you learn how to this thing. I feel very excited when I get the bigger companies. Alhamdulillah, today we have secured almost all the GLCs.
So when you started off, what was the fear at that time? Is there any fear?
Oh yes, definitely. The fear is not getting patients. That was the main thing. You open a clinic, and you do not know whether you will get patients. I opened a clinic in a Chinese area. Kota Kemuning kebanyakannya penduduk
Chinese area, right?
Chinese. the trust, you have to build the trust towards the Chinese patient. It's not easy to build the trust towards the Chinese patient. Alhamdulillah, with the way we treat the patient, the facilities that we have in the clinic, the medicines, the type of medicines that we have in the clinic, everything actually helped me to grow. It's not just me alone, but a lot of other things as well. Particularly the medicines, they're very, very careful in the medicines, what kind of medicines that we give. They're generic, they're also original. Generic pun macam mana punya generic, and most of the patients are quite T20, the higher income group patients, and they also visit hospitals, and they know hospital give what kind of medicines, and if
they
you
compare.
So price issues, everything.
Who was your biggest supporter during these difficult days?
Actually, when I first opened the clinic, my mother gave me 100,000. When you open any new business, no bank will trust you. Bank, you can't go to the bank or you can't go anywhere and ask for loan. So my mother gave me 100,000. I managed with the 100,000, the renovation and the bit of equipment.
How do you convince your mother?
She is okay. She's okay. Alhamdulillah. She's okay. When I told her about this, and I told her I got no money, and then she gave me 100,000 at that time, and I opened everything. And but today what we do, we have monthly, we will give something to our mother, a very big amount that we give until today, non-stop.
Wow.
Non-stop, we give. So every December 31st, I will go and deliver her 12 post-dated check.
Wow.
It has been a tradition for so many years. So I go to her and I give her. So that loan does settle already.
Yeah.
Whatever it does settle. This is just thing that, because that is her berkat, yang she gave the money. I think that actually it's from her heart, from her prayers, actually bring me up today lah.
Make it a successful venture.
Yeah.
How was your experience leading a clinic chain?
Today, it is not easy. You see, initially when I first started, saya seorang je in the clinic, saya seorang, and I work 24 hours a day. And then lepas tu, kalau only thing, one of my very good friend of mine, he was doing MRCOG.
Okay.
MRCOG. So my wife was expecting, and she delivered. And I wanted some help, because newborn baby kat rumah, and then I cannot lepaskan clinic and go. So my friend told me, it's okay, I will do locum in your clinic for free. All he wants is a space to study.
Okay.
A space to study. So he told me, kat rumah dia, he cannot study, he need a place to study. You just started clinic, not many patients. I will see the patient for you. You don't need to pay me anything. I just need a place to study. So we contract lah. You give me a space, I do locum.
Yeah.
So he actually worked in my clinic for 2 months for free. But I'll be there. Then after that, when I go back home, dia akan datang and take over the clinic. Malam tu I datang balik, I sleep over lah.
This is the early days lah.
Early days. And he has failed his MRCOG 3 times already. So when he studied in my clinic, he passed. He passed. He was very happy, and he told, this is a very lucky clinic. This is a place to pass. So he helped me out during that particular thing. So finance pun susah untuk saya. I don't have enough patient to pay him. So he helped me out and this thing. So then after that, after about 8 years, me being alone, then the clinic was getting busy, very busy, and I could not manage by myself. It is very, very busy. And I thought of employing another doctor. That's where I started employing my second doctor.
Okay.
So in my clinic, we had room 1. The room 2 is actually a treatment room lah. So the treatment room tu kita convert jadi treatment plus consultation room. Treatment plus consultation room. So that doctor will come. Dia pun dia ada timing dia. So dia akan tolong saya lah. So pagi I will be myself. Then he will come certain time and he will be there. Then after that, 2 of us will be there. So my first one I employed after 8 or 9 years. 8 years. Yeah, 8 years. 8 years. After 8 years only, I employed the second,
second.
doctor to help me. So the business was getting more and more. Then we realized that this space is not enough for me. If I want to grow, I need a bigger place. So I went to Highcom Gamuda, and I know Highcom was building a new shop lot opposite to our area, because this current shop lot we are renting. We didn't have our own one. So we went and spoke to them, and then they told us, okay, they are constructing the shop lots kat sana. Once open for booking, we will call you. So first they gave to their employees, whoever were interested to buy. Then after that they opened to public, and they called me. They put me number one. They called me, and fortunately I managed to get a corner lot. Tapi kat belakang, tapi still can be seen from the front lah. So we thought, okay, never mind, we just take the corner lot. It was quite high, but I took a risk and buy it lah. It was 1.5 million at the time. 1.5 million
Yeah, it's a lot at that time.
A lot of money at that time. So I thought it's okay, never mind, I will take it. And fortunately the bank also gave us a loan to this thing, and they also gave the renovation loan at that time, because by then, by 8 years, our financial in this clinic was already strong already. So based on our financial report, everything, they gave us I think about 2.5 million at that time. 2.5 million. So 1.5 for the building, and another 1 million for
Renovation.
Yes, renovation. So then after the ninth year, then I got the keys, and I did the renovation for about 6 months. Then we moved to the new building. And when we moved to the new building, it was a big risk. It was very extremely big risk, because everything, your expenditure, everything increased. Increased to three-fourths. Your electricity, your water, your staff, everything increased, and the building is big. But the patient load is still the same. From here to here, the patient load is still the same. Still the same. But your expenses has become 3 times more already. That was a time that I realized, I thought I want to go big, but then I got not enough money again. And I did not take my salary for about a couple of months during that time, afraid if I take the salary, the thing will go down and everything. But I at that time, all these things actually make me very strong. And after that, I know how to manage my finance. After that, now I know if I want to open, I know what I should have before I open and all those things. Now I know. So at that time I didn't know. So, but I managed somehow. I managed, because when we went there, I also employed another two more doctors. So we had about 3 plus. We had another doctor. So we had 2 additional doctors plus me, 3 doctors. So I employed another doctor. We have to employ another staff, few more staffs, and all those things. But from there, when you put in more doctors, then you can see slowly more patients will start coming in, because your service is fast.
Okay.
Your service is fast. Okay. Everything is, waiting period is already less. You have more facilities over there, and patient load starting to getting more and more. So over about 1.5 to 2 years, we are at the peak, and we already need more doctors already. And today we have about 22 doctors with us. 22 doctors are working
at Kota Kemuning.
In Kota Kemuning, we have about 8 doctors in Kota Kemuning. 8 doctors in Kota Kemuning. But including the others and all those things, we have about 22 doctors with us today.
So to recap back, the first 8 years, you were alone?
Yes. Yes, correct. Yeah.
You were alone. During that period, was there come across your mind that you are planning to expand? Or you just go with the flow of business? I mean, as a doctor, sometimes you look at patient, and then sometimes you get carried away to think about the business expansion. Which one comes first?
Because of the crowd was getting more and more, and I know that if I want to grow, either I have to decide you want to grow or you want to stop here. This is enough for you, or somebody else will open a bigger one, and the patient will start going to that place. So I thought, I'm still young, less than 40 at that time. So I thought, might as well go ahead, take a risk and go. You have to take a risk. You take a risk and go. And I bought the building, and I it was a big risk. It was a very big risk. And if you manage your finance poorly, you can go into a loss. But Alhamdulillah, somehow I managed that phase lah.
When you talk about managing risks from your personal opinion, Dato', how do you do it? I mean, the way that, do you seek advice? Do you do some research? Do you ask around?
Yes. By that time, my friends are not doctors. My friends are used to be business people, more involved in business.
Okay.
You 8 years you're with patients, and some patients become your friends. So mine is already open. No more how I was in government hospital. Government hospital, you are just your friends are doctors. You talk about medicines. You don't talk about anything else. But at that time, I already have friends of different field already. So talking to them, mixing around with them actually helps me a lot. I got good set of friends lah. I got good set of friends, and these are the people who actually taught me how to do things into business. How to apply loan. How to play around and this thing. The friends actually, good set of friends actually have advised me on my the next chapter, my next.
So what have you learned from your first expansion towards the subsequent expansion? The main thing that you learned.
The main thing is managing your finance, managing your staff, managing overall the whole system, the medicines and everything. But being alone last time actually have helped me a lot for today. Last time, I even know if you give me one particular medicine, I even know the cost price. The cost price of the medicine. Of course, now I don't know. Now we have so many medicines in the clinic. But at that point of time, I know the cost price and I know how much we have increased. We know that thing.
The margin.
Yeah, the margin semua kita tahu. Tapi sekarang with that formula we apply. We already tell all our people in the purchasing side what to do and all those things. So that actually helped me over a period of time lah. This period of time.
Dato', how do you balance being a doctor and a business owner?
It's not easy, but it's very interesting. It's very interesting. Today, I don't work like how I used to work last time, but I still go to my clinic every day. I have my time. I have time to see my patients, and I have time to do more of administration work. But now it's already like autopilot.
Okay.
You see, today I have put everybody into system already. I've got HR department, I've got purchasing department, I've got marketing department, I've got dietitians, I've got claiming departments and all those things. So I've already trained all of them. And all this job I used to do last time. Last time. So I know, I can see. Just by looking, I know where the mistake is or whether they're doing rightly and other things. So since dah ada all these things and I've already trained them, it makes my job much easier right now. But all this is what I learned in the last 8 years by myself. I've gone through a lot of things during that time. A lot of things have gone through.
But are you inclining towards more operation, or you still want to maintain your clinic session?
I still love to go to clinic. I'm a doctor. I still pergi, go and see my patients and all those things. Even before coming here pun, I just saw a few patients and rush. It's a bit late.
So I went through your background, Dato'. Polyclinic Shaik have won multiple awards.
Yes.
I mean, how many total?
I think more than about 15 awards.
Yeah, 15 awards at least.
Yes.
And from you personally, Dato', which one means the most to you and why?
Okay. In fact, a lot of companies actually sometimes they call us to participate and all those things. But what we wanted is the SOBA award. It's by the Star, SOBA award. That was a very prestigious award, and I told my staff somehow we must get this award.
Okay.
We must get this award, And we have won 3 awards from SOBA. One is the Best Entrepreneur. That's myself, Best Entrepreneur of the Year. And then the past 2 we won Best for Marketing, and we also won Best for CSR.
Okay.
CSR. So these are the three awards that we won, and this is a very prestigious award. This award is not like you just buy table and then you get award. This one is with the judges. So you have to submit all your whatever you have done to them based on what criteria you are applying. You submit everything, the judges will go through, and then they will have an interview, and they will see everything is right. They interview you, then only they will announce the winner on that particular day. You
Oh,
don't
you
even
don't know.
You don't even know. You will just go for the dinner, and they will announce. So you may win, you may not win anything, but fortunately, if we won the awards, lah.
Any particular reason why you were eyeing for this award?
That is very important for the image of my company, for image of company. You know, SOBA is, those who are in business, they know lah, because it's not only medical guys, itu. All the business will participate for that award, you see. So it all depends on how you present and what you have, what you have done, and all those things. They look into all these things. Then it is very important for the image of my company, you know. So later, if I want to apply for panel or something, these things are there, you know. So I always tell my panel, they will tell, you know, your price is a little bit high compared to the other places, but we are branded, you know, we are branded, unlike the other clinics which does not have anything. We have all these things, and we have certified, you know, these people have given all these things. So and some companies, it's a prestigious things to award us the panelship or what, because we have Shaik. Shaik is there, our panel is Shaik, you know. Sometimes so we feel very proud. You know, they are bigger companies, and they have us as their panel.
So when you talk about preparation to get that award, what kind of preparation that your clinic does?
What we did actually, before even applying for SOBA award, 1 year I was going through all the other companies which won the award. I was going through about the company profile. I was going through what is so special that this company can win this thing. And there was a year that we applied, we did not get anything. We came back and we said, okay, we were very eager to win, but we did not win anything. Then we again study how to apply, what are the things that we need to have before we apply. So then the next, actually I spent 2 years actually. 1 year buat tapi tak menang. Then second year buat, and then applied and menang. And I was telling my staff, we were outstation. I was telling my staff, okay, 7 o'clock we have to go, and about 3 o'clock we were in Tanjung Malim. So we went at 7. Okay, we won't be winning anyway. Just go. Just go mandi, and then kita just pergi ke sana, and we won the best entrepreneur. And that actually, it was a very high award. You know, the best entrepreneur of the year. Very high award, and I won that particular thing. So my homework for the last 2 years of what I did, everything I put inside in papers, all I did, and I give them. So then I know, okay. Then the second and third award we won after 2 years. We gave a break 1 year. Then again we applied and we won the other two awards, because we already know what are the things that they want, what are the things we need to prepare and everything. So we won another 2 awards.
So you won the best entrepreneur of the year.
Yeah.
That was in 2019, right?
I think 2019.
2019.
2019, yeah.
So when we talk about preparation, you mentioned 1 year preparation and 1 year you know already where to fill in the loophole. What kind of loophole are you talking about?
What are the things that you need to do, you know, as an entrepreneur? What are the things, what are the qualities the entrepreneur should have? All these things I should have before this thing, you know. If you don't have all this, you can't apply for things. Whether you have, how do you manage your staff, how do you manage your business, how do you manage your financial, everything. So these are the preparation, and also it's a homework for me, and also to actually to make me a better businessman. You know, by doing all this. So I've put everything into a proper place. Then I applied for the award.
So when you won the award, does that bring certain validation of your hard work for the past?
Yes, I felt very happy. Felt very happy when my name was announced and my picture was at that the screen. about 1,000 of people
Yeah.
looking into it, and you go and take the award, and this award, you didn't buy table and get,
Yeah.
you feel very, very happy, and then you come back. And then after that, in our letterheads and this thing, then any official thing that we put this thing, in our emails, we put the SOBA awards, the 3 SOBA awards that we won. That actually carries a value. So they know, anybody reading it and they see down, oh, okay, this is not an ordinary clinic. It's not like any other clinic. These fellas have got all these things, So that is actually a positive thing for me. And that actually really helped a lot.
So what's the biggest lesson, Datuk, that you learned throughout this experience from the business point of view that nobody or any school has taught you?
I think mostly managing finance. Managing finance is something that I learned by myself. Even like I was telling you, when I went into the from a smaller to a bigger clinic, the financial problem that I had during that particular time, and I was really don't know what to do. I didn't have enough money to pay salary at that point of time, but somehow with the business, so the planning, your planning is very important. When you want to move to the next step, you have to plan. You have to plan everything correctly, rather than just do without planning. Then you will sangkut. So the planning is very, very important. So then after that, I know, okay, from the next thing, what I should do, how not only your finance, the medications, whether the medication will be enough, number of staff, if you're going big, number of staff, are they enough to support when you go big and all this. So planning is very, very important on the next this thing.
Any reason, Datuk, why didn't you take MBA to top this knowledge up?
I never thought of it at that time. I never thought of it at that time. MBA is thing, because I was also busy with managing, and I takut nanti go and do MBA, I may not be concentrating much on my clinic. And I was also thinking, what's MBA going to do on me? Because I'm not going to work for somebody else. I'm going to work for my own
company.
So I do a lot of simple readings and listen to a bit of lectures and all this kind of things I do. But of course today my son is an engineer, so he is doing MBA right now. So I made him to do MBA right now to be more systematic. I think that's more systematic. So sometimes when he come back from his classes, he will ask me some questions which I could answer.
Wow.
Now I could answer whatever he asked me. So yeah, I didn't, basically time tu masih muda lagi, masih dalam you want to bring up your business. So I tak take any course at that time.
What's your advice to young doctors who want to open up a clinic chain?
I think for today there are many doctors out there. Today there are a lot of GPs. Because of the government, the contract issues, contract issues. So many are resigning. And today, if I put up for advertisement for doctors, practically within few minutes I'll get an email. They want to come and work, and there's a lot of them. But I think for the new doctors who are coming out, it's best don't go and open clinic, straight away, because they don't know. They don't know outside there what's all about. It's best you work with somebody, learn everything, then you open up a clinic, but not next to your fellow where you learn lah. In somewhere, there are a lot of cases, kerja lepas tu buka sebelah ada je. So learn from the seniors how to manage, because even the management pun it won't be as good as the senior doctors have been there in GP practice. GP's management is sometimes a bit different. Kan daripada in the hospital. Patient want everything fast kat GP. Not to say you kena bagi antibiotic ke apalah, tapi you must know how to treat the patient well. There are a lot of things you have to learn this thing. And opening clinic is not going to solve your issue. You work first, at least you've got a fixed income. When you open a clinic, we don't even know whether the clinic is going to be
survival.
That's right. And today you see a lot of clinics are closing down. You see a lot of clinics are closing down, and if it's in in a housing area where new shop lots are open, and you will see more restaurants than a clinic right now. Sorry, you see more clinics than a restaurant right now, right? In an area, just front and back, you will see 8 clinics. It's normal. It's normal. And today we have a lot of big chains. They just open everywhere. Everywhere they just open. Even in an existing clinic, which has been there for 20 years, these new people will come and open. The big chains right now, there's so many right now, they just come and open. Opening clinic and killing the other fellas is that you must be a good doctor first. Learn from your seniors or wherever. Work first, get the experience, then you open a clinic. And today, if they are coming to me for employment purpose, I don't take I don't take doctors. It's like I will see what they have. You know, if they have diploma, let's say diploma in skin or diploma in something, then they've got a higher chances to get into my organization. If they do not have this, a bit difficult. So I make sure my doctors have got some additional things, you know. Don't stop just at MBBS. If you're coming as a GP, you do some other courses. There are a lot of courses, OHD courses, wound care courses, so many courses are there. Do all this kind of courses while you work with somebody. It also enhances you, you are a better doctor. You are just not a GP, you have got something there as well to treat. So these are the things, very important things that the young doctor should know, rather than just book up clinic and then duduk kat situ, patient tak datang, then then you drop your price, then you put advertisement, tak ada consultation, then you joget-joget kat TikTok. Our profession has become so down. We have to maintain our standard. You don't see a plumber.
I agree in that.
You don't see a plumber joget-joget and asking for the doctor yang sedang joget-joget asking for. So you have to be a professional. You're a professional. Behave like a professional. Behave like a professional. Do extra. Be a good doctor. Be a good. And there are a lot of skills that you learn. Even talking to the patient. It's a skill. It's an art. It's an art. It's an art. You must know how to talk to the patient. All this, there are a lot of courses right now. Go for all this and learn and be a good doctor. Patient will come.
You notice they call it influx of doctors who quit and join GPs as a locum doctors, right? From your point of view, experience, do you notice there's a difference in quality nowadays?
Oh, definitely, yeah. The diagnosis. Differential diagnosis, giving medicines, the dosage of giving medicines, it's very poor. It's very, very poor. It's very poor. I don't blame them. Because they don't see much in during the housemanship time, and treatment in the hospital. That's why I was saying treatment in the hospital and the GP is totally two different things. You see, sometimes they may be just in pediatric departments sahaja, for 2 years at Houseman MO, just in pediatric. They do not know how to treat this thing. And some will be just in surgery, but do not know how to treat pediatrics, do not know how to treat. So these are the things that they need to learn over a period of time. And this will take time. This will definitely take time. And sometimes we see some doctors, even a normal HFM pun, he can't, he don't know what is HFM, because he was in surgical department all the while, don't even know what is HFM. So we have seen this kind of doctors, but I don't blame them. It is because of the training. Tapi over a period of time, when they come out, when they do more locums and all those things, then they will get experience and they know how to diagnose. They know what are the correct medicines to give and all those things lah. Last time, I purposely go to a busy clinic and work. Not because they don't pay much. So I purposely go busy clinic to learn from the senior doctor. Why is this doctor so special? There's so many clinics, but I will ask for locum at the busy clinic. So I pergi sana, I belajar. I will read what the doctor give, apa ubat dia bagi, macam mana this treatment from there. And that's how I actually learn and I practice nowadays. I've learned from my senior doctors, and I think the junior ones also should do the same thing. Go and do locum in a busy clinic, not in a chill clinic. Because when you see in the locum group, is the clinic chill? They will advertise the clinic is chill. but they pay this much. Oh, okay, that's the good. Now that is the bad thing. You get money, but you don't have any experience, right? And then also, if you put an IV drip, is you will get 10 ringgit extra. This, all kind of things they do to attract, to do locum, and then unnecessarily they go and do IV drips lah, take blood for investigations.
Just for the incentive, right?
Just for incentive. Which in my clinic we pay high for locum, but we do not give all this incentive and everything. I don't practice giving incentive, because if I do that unnecessarily, they will do, and the patients, feel, why when I come I have to go IV drip and all kind of things.
So you mentioned earlier there's clinics are mushrooming, and how, from your position as a director or founder of Shaik Group, you make sure Shaik is different compared to others?
Well, what I do is, we have come to a level that we treat T20 and above. T20 and above, not to say that we don't treat below, but we open in an area where the high income group area, high income group. This is also from my experience, because my first clinic was in Sunway, in a lower income group area. So I opened over there. That was my first clinic. And so me and my brother, we actually opened over there. And we noticed that we don't have many patients, because we do not have enough panels at that time. And our clinic was very, very small at that time, very small. So that's where we learned that if we want to grow, we have to leave that place and go to some other place. So I went to Kota Kemuning, and my brother went to Bukit Jelutong. Both
are high income.
High income group. So we went to that place, but not just opening a clinic there you will do well. No, you must also study the culture, what they want, what the patient want, how the clinic need to be, what are the facilities that you should have, and all those things. So these are the things that actually help us, putting certain equipments. And today we got a lot of equipments in the clinic. The medicines type of original medicines, and I was telling, generic pun, the high-end generic, all these kind of things. So we concentrate on a T20, but the price is not very high lah. The price is just reasonable price, just like any other clinic, reasonable price. But you get everything there. You get everything. So you must have, like, when the patient walk into you must have everything there. The only thing that he has to be referred out is unless absolute necessary to be referred to the specialist. Otherwise, everything should be settled in your clinic lah. So that's what we did, and we made the clinic a bit impressive.
The interior design,
the
right?
interior part is very, very
nice.
important. Yes, it's very, very important. That I did about even 20 years ago. When I first started, I already made my clinic very nice at that point. Of course, now there's so many clinics. Now you've got a lot of clinics with nice interior. The aesthetic clinics are all very nice interior. But interior and the service, the nurses, training the PR, how to talk to the patients, all that are very important. Not only you sitting in the room, but you also have to see how your nurses speak to their patients, when they give the medicine, how they actually address that thing to the patients. All this is very important, because any mistake nowadays, the patient, the finger is faster than the brain. Right? Immediately into your Google review. So you have to be careful in all those things. So I look into all this, especially as they come into the clinic and they leave the clinic. Everything is being looked into.
I noticed your polyclinic serves a lot of service apart from outpatient clinic, right? When do you decide that you're extending the services?
Yeah, you see, when what I notice is right now, although there's no drug separation, drug separation is already happening. It's already happening. They say it's no drug separation. It's still given by the clinic. No such thing. It is going to happen, and it will happen.
It will happen, right?
Definitely slowly. It's already happening. It's already happening. Today, the TPAs control us. Actually, we're supposed to control the TPA, not the TPA controllers. TPA is telling us to give prescription, and they will get the medicine from the pharmacy. They have their registered pharmacy. Big pharmacies are there. and we are just writing prescription and giving to them. I'm talking more on the long-term medication lah, long-term medical diabetes, high blood pressure punya ni. So it is already happening slowly already. Then I realized, as a GP, our main income is from the drug, not from the consultation. You know, the consultation is so low. It's so low, not from the consultation. It's from the this thing. Then I realized that we have to do something different. We cannot look into this giving medicines and making money out of medicine. I've got 100 over staff with me, and I cannot be depending on this. So what I did, we have changed everything. That let it be, it's okay, but we still have, you know, other patients yang ambil ubat tu tak apa. Some of the companies also allow us to give the long-term medications. It's all fine. But what I did is, I have actually send my doctors for courses. Those senior doctors with me who, when they first joined, did not have any course, I sent them for courses. I've sent about 6 doctors for OHD course, and all of them have passed OHD. So now we are branching out into OHD courses. Now we are also getting employing some doctors who are expert in wound care. So we are channeling into different. We cannot be just giving medicines. We are channeling into different things. So we are going into OHD. We are going into wound care, and I did diploma in diabetes So I'm treating more of diabetic patients. 20 over years dulu bila I buka klinik, ramai budak-budak I tengok. Tapi sekarang all the budak-budak itu dah kahwin and dah ada anak and dah pindah out of that place already. Now I'm seeing the parents who brought them. So they have diabetes, high blood pressure. So now we are treating them. So we did an additional course and all those things. So now we are treating this kind of things. And our revenue is okay. Our revenue is still okay. Although we have lost, no, not we, almost all the clinics have lost this thing. And we have got revenue from all the other things. And also, these courses, how we do is we also participate. We also give to HRDF, and we give into HRDF. We have pool of money there in HRDF. So these are the money that we use to send our staff for courses.
You mentioned about your postgraduate diploma in diabetes, right? From Warwick University.
Right.
So, what made you realize that you need to deepen your knowledge in diabetes?
Actually, initially I got no interest of doing anything, you know. But when I noticed that the pediatric group of patients started reducing in my clinic, reason being that Kota Kemuning was a developing area, but now no more new houses, nothing. Right? So what I used to see the children's 22 years ago, they are all now adults already. They pun dah kahwin, they pun dah berpindah out of Kota Kemuning. Only the parents are left in Kota Kemuning. Then I realized that I'm not going to see them anymore. They are all no more. Now I'm going to see the adult group of patients. So I have to prepare myself to treat the adult group of patients. So then, at that point of time, there was under the MMA, they actually told about this program in MMA. So I saw and I read about the university, and I think about 18 of us from Malaysia. We are the first batch and we actually signed up for this particular program, 1-year program, very intense course in diabetes, management of diabetes. And I tell you, this course really helped me out, shaped me out how to treat diabetes in a proper way. Not only treating just by medication, but a lot of other ways as well. You know, the diet, lifestyle changes and everything. And you follow cara orang putih lah, in UK, and the lecturers also from UK. Of course, there's a Malaysian lecturer as well. But it was very interesting, very, very interesting. The course is very interesting. And then after graduating, and I went to Warwick for the graduation. After graduation, when I come back, then I changed the whole thing. So we have a unit now just for diabetes treatment. We also have a fundoscope camera in our clinic, and we have an ophthalmologist, not in the clinic, but this fundoscope, we will take a picture, we will send via cloud, and we get the report. You know, once a year kind of screening for the patients. So we have made the diabetes treatment, in a very planned way, Then we have calling the patients before we start insulin, we call the patient. We have got a teaching room upstairs as well. We have got a diabetic nurse who comes and teach the patients how to take the insulin, and a lot of program for diabetic patients.
Meaning you adapt what the Westerners are
Correct,
teaching you from the courses.
Yes.
How do you feel? I mean, how do you see the outcome of the
It's
patient?
good.
It's good.
It's very good, very good. We have got a lot of patients with poorly controlled diabetes right now. The diabetes is very well controlled. The fear of taking insulin dulu kan, dulu here after bagi banyak ubat, then only we start on insulin, because that's the patient's, patients are
mindset.
fear, But in UK, after the second is already insulin ready. Third is like mesti insulin already. So that kind of thing. So when we adapt all these things, when we teach the patients, we see a very good control in the diabetes and it's nice. It's nice to see them. They're very happy. They get motivated now. Dulu they'll be very makan sikit pun dah tinggi. After they know what to do, they're motivated right now.
So, what do you see, Dato'? Yourself, the purpose of life from your point of view.
Purpose of life
from your picture and from your lens.
Well, purpose of life is a big thing. Actually, I think from what I was last time and today with our organization today, I'm happy to see from how I was last time and with the organization right now, with all properly managed and everything, but we can go even more. There's no stop here. There's more that we can go, and we can do it.
If you can share your vision for your healthcare venture, what would it be?
It has to be very systematic. It is not very systematic, particularly in the GP punya side. We are GPs. We are general practitioners. We supposed to be controlling everything. It's not the case today. The thing is, somebody else who are not in medical, they are controlling us. Like the TPA is controlling us. A lot of other fellows are just controlling the GPs. So this is something that we need to change. The organization has to be very strong, the GP organization, and we have to fix all the terms, rather than they fix and we follow. That's what's happening right now. And if nothing to be done, if we don't do anything about this, it's going to get a big problem.
I want to understand further on the TPA. How does it related to GPs? TPA is a third party administrator, right?
Third party administration. So they like, let's say a company, they will employ TPA to manage their medical affairs. Medical affairs. So the company will tell the budget for them. Okay, and this TPA will manage this. So they will instruct us. This company, these are the things that you can give, these are the things you can't give, and this company, the budget is only this much. This company, you have to give all the. They will not tell us cheaper. They will not tell us inferior medicine. They will tell we have to cut down the cost. So cut down cost, we know lah. It has to be cheaper medicines and all those things. But sometimes we need to give a better medicine to the patients. We cannot compromise on this kind of things. Of course, the HR of the company is the one who wants to bring down the budget. He brings down the budget and he wants to be the hero over there. Right?
Yeah.
But he's actually sacrificing the health of all his employees. Right? If you cut down a lot of things, today you may be a hero, but tomorrow the patient will suffer with all kind of complications. And by then he will be in another company, or the HR will be in another company, or he'll be somebody a bigger position.
Yeah.
But these are the people who are going to suffer. See? So these are the things that we have right now. It's difficult for us to actually manage the patients. Everything we have to ask TPA whether this is covered. Sometimes they come X-ray is not covered. So a lot of things. Different company have got different kind of policy. So it's difficult for us.
Can we bypass them?
If bypass, they won't pay us. We cannot claim. And if we have taken this they will not pay us. It's already in contract. These are the things not covered. So these are the things making us very difficult to actually treat patients and all those things. And I mean, not all doctors are bad.
Yeah.
We know how to treat. We don't give unnecessary medications. We don't send them for unnecessary tests and all those things. But they should understand. They should understand this thing. But and also the separation of medication right now. I was telling you earlier. We can only give prescription and we cannot give them long-term medication.
It's happening, Dato'.
It's already happening. This is already happening. It's happening. It will be bad. Almost all the banks do this, But when you ask for a reduction of reduction of your interest in your loan or what, they don't even look at you, But we are forced to do this kind. I got a bank who actually called me. And we, one of the very good bank, they actually called us and they said, hey, your health screening is this much. And I said, yeah, but we are giving all this kind of things. And they said, can you reduce a bit? She asked me. Then I asked her, I'm also having bank in your loan. Sorry, I'm having loan in your bank. Can you reduce my interest? Right? So she just kept quiet and she said, okay, doctor, it's okay, you do. Because, cost is increasing.
Exactly.
Cost is increasing. So it is not like last time. Last time 30 ringgit, 20, 30 ringgit, you can see cough, cold, fever with the medication consultation, yes. But today is not the case. Everything is increased. The medicine cost price itself is very high. Because then they compare our price with the pharmacy price. Our price and pharmacy price. Pharmacy price is always cheaper. GP's price and the hospital price is a little bit more expensive. Yeah, we follow the recommended selling price. We mark up certain percentage. And the pharmacy is totally different. Sometimes you will be surprised the pharmacy will be cheaper than the cost price. And we also do not know how, but end of the day, when the patient go to the pharmacy to collect their long-term medication, instead of spending, let's say, 150 ringgit in my clinic, probably you spend about 200, 250 ringgit there with supplements and all those kind of things. So this supplements all this, few 100% of profit margin already made over there. How can a pharmacy or any other place sell below the cost price? There must be a reason selling below a cost price. And then these patients will compare the cost price of the pharmacy, the price of the pharmacy and the clinic. And the clinic and hospitals are very, very expensive. 30 ringgit expensive, one particular medicine. But then they do not know they have already spent 250 ringgit instead of spending 150 ringgit over here. So these are the things that we are facing. A lot of problems we are facing. So we have to go. Don't depend on medication. Do something else. The clinic has to do a lot of wellness program and all kind of things.
So, Dato', if you're given the, I would say, power to lead these changes in terms of creating an ideal GP ecosystem, what will you do?
First thing is GP have to be strong. I will make sure that all the GPs are strong enough. GP is the voice, not others. Because we are the main people. They are making money out of us. And we are the one, let's say, if all the GPs in Malaysia strike today, finish. Finish. GP strike today, all the TPA are gone. TPA gone, all the number of foreign medical checkups, everything is gone. We are the one actually important for them. But that's not the case. I will make sure GP is the main voice and we dictate. We dictate. This is the price. This is the thing that we want. These are the things that have to this thing. Otherwise, we are not going to do. But unfortunately, this is not happening. This is not happening. The bodies have to be strong, no matter MA or per diem or whatsoever. All have to sit together, form something very, very strong, very strong, to actually make sure GP is the voice. They cannot dictate to us, or you give this, you give that. That's what's happening right now. They are dictating to us and we are following. And if we got no choice to follow, if we don't follow, the other doctors who are just coming up, they will follow. They just want business, the younger one, they're okay. Now you can see, you come to my clinic, I don't give consultation free. consultation is free. That kind of things. So I will make sure GP is the voice. That's the main thing that we need to do.
How's the society now? Are they unity or still?
Yeah, they are there, but there are a lot of other problems to, not only GP problems, they got other problems to manage as well, and all those things. But I think they should look into the GP's affair as well when all these kind of things are happening. They should look into. They are looking into it. They are looking into, but it's not easy. It's not easy for them as well. They are looking into it, but not very keras like keras sikit and this thing. And if you are talking in other countries, they're just going to strike. Other countries, Malaysia, we don't do that.
Yeah, talking about other countries, Dato', do they have TPA also?
I believe so. I mean, like UK, there's no TPA. UK, I think, is more of insurance based, and it's totally a different thing. I think, in Singapore, yes, they have TPA. Singapore have TPA. They have their TPA, but I do not know how actually over there it works there lah. But some countries like in India, Pakistan, those countries, it's all prescription based. You write prescription and you give the patient. Patient have to buy outside, but your consultation charges are high.
Yeah.
Here consultation charges also, some of the industries, they want you to go as low as 10 ringgit, 8 ringgit. You are a doctor and you're being paid 8 ringgit to 10 ringgit for your consultation. It's very, very low. Very low.
By the way, Dato', throughout all your experience, your life journey, do you think you would be the same person today if you had succeeded in becoming an orthopedic surgeon?
I don't think so. Definitely not. Definitely not. If I'm an orthopedic surgeon, I may be just an orthopedic surgeon, going to hospital, operate, see my patients and come back. Definitely no. That's the thing I was telling you earlier. We just plan.
Yeah.
But the best planner is God. So He has planned a different thing for me. I was depressed at that point of time. When I failed. But today, alhamdulillah, everything is okay. I'm okay, very happy. And I've got this. My friends who are orthopedic surgeons come and ask me about business views. How to get this thing done, how to open up a company. How do I manage with finance and everything. I've got a lot of friends who actually come and ask me today, who are specialists, and some of them are very impressed with me right now. Very impressed with me of what we are having and all those things.
So if you could do it all over again, would you?
To orthopedics?
No.
This? Oh yeah. I love this. This is my passion. Besides seeing patients, I love the business, running up the business, setting up, and I get excited when I want to open a new clinic, new branch or what. I'll get very excited. I will plan it properly. Even before the construction takes place, the construction of the building by the developer, I will already plan my sketch out, and I travel to a lot of countries. Not only I see the clinics and hospitals there, but I go to the hotels. I see the hotels, how the hotel is, what are the color that they use, and apply that into my waiting area. So if you come to my clinics, it will look like a hotel. It will look like a hotel kind of concept and all those kind of things. So these are the things I love doing this work.
So what's next for you, Dato'? Is there any goal that you haven't achieved yet that you're looking forward to?
What I want is to have this kind of concept, like the clinics in what I have right now, in every state, which I have not achieved that particular thing yet, and that's one thing that we want to have it. Let's see. We still have time, and we will work on it.
So meaning to say expansion towards another state.
Yeah.
At the moment, it's purely Klang Valley, if I'm not mistaken.
Mainly Klang Valley.
Do you have a hope? What kind of legacy you want to leave behind?
Not really. Not really. I think I've achieved everything till today. I've achieved what I wanted. I make sure I get it and I have it. Alhamdulillah, God has given everything to me today. But it's all from hard work, from previous. I remember, we didn't have money, difficult, was very, very tough. But today, alhamdulillah, everything is okay.
That moment will always be there, right?
Of course, it will be. It is always, God can give, God can take. You have to be very careful. So we have charity. We have one department. Just for charity itself, we have one department, whichever the zakat money, how we plan on the zakat money. We have one department to actually uruskan all those kind of things. We also have a tahfiz school. We run a tahfiz school with my friends who are not in medical line. They say, don't mix around with medical. You must mix around with friends with other these things. So I've got friends along with me. We run a tahfiz school. So we have and internationally we have given money to build a mosque. And in Cambodia, the well, water. So we've done a lot of charity things, So we've got a department, and we also see the lower income group patients. There's a department which see free. We
okay.
Yeah, free. We don't charge them. We have that thing also going on. So we have everything there. So we don't only make money. We also, give to the one who needs as well. So, and sometimes we also have like a fine system to our staff. If they don't do this, we will get fined. But we tell them, I'm not going to take this money. This money is going to go for your zakat. So they're okay. It is like, okay, this fine is not macam,
Yeah, not to penalize.
It's not penalize, but to teach them. So next time you don't make this kind of mistakes, So then after that, we will tell them, this is for zakat, or if anybody is leaving, we'll just use their money for for
farewell.
Okay, it's their money, we don't take all these things. So we have all these kind of things. So I believe that we should give as well, to the poor one, to the needy one. So this has been being practiced for years, and there was once when I went for Hajj actually. When I went for Hajj, before I went for Hajj, there's one tahfiz school come and approach us, and they wanted us to give medical treatment to them. So I told them it's okay, we will give medical treatment, and this is how we will charge to them and everything. So this was just 2 or 3 weeks before I went for Hajj. Then I went for Hajj, and while I was doing tawaf, suddenly something came to me and told me, why are you charging tahfiz students? And they are also anak yatim. Why are you charging them? Of course, the school has got fund to pay. Then I came back. The first thing that I did, that I called the school up and I told the cikgu tu datang, guru besar semua datang, cakap tak apa cikgu, tak payah bayar. Kita just ikhlas saja. So from 2008 until today, we are not charging. We are not charging. Anybody come from that school, it's free. We give free. It was something that I got. And after that, after I came back from Hajj, we did a lot of other things as well. But that was the main eye opener for me. Telling me why I should charge. So I never charged them until today. But we have others, so we got a lot of other things, the mosque and a lot of things that we do that we do not charge, and a lot of other charity works that we do. That is the reason one of the award that we won for CSR is we have included all these kind of things. And during the flood in Shah Alam last time, Batu Tiga flood, we actually collaborated with the Adun, and we did a lot of work, charity work during that time as well. So all this actually helped us to win the award as well.
It's interesting to know, Datuk, because as a Muslim, we know the fact that if you sedekah, you will get abundance in return.
Yeah.
But from your business point of view, when you decide on charity department, was it when you make money or before you make money itself?
After I make money. After I make money. Before, I never thought of this. I never thought of before making money. All these ideas were not there at all. Maybe I was young. I do not know. This thing. But after, when I make money, and trust me, when you give, you will get 100%. That is the best. I will always say when I give a talk, I will say that is the best fixed deposit that you can do. You don't need to put into the bank. You just give. You will get. You will definitely get. So I've been practicing that for so many years since I think the lesson was 2008 lah. 2008 after I came back from Hajj. That's where I actually start seeing all this. Then I started giving more and more and all those things.
Was the return tremendous from your experience?
Sometimes can be tremendous. Sometimes you can lose the tougher.
But still,
still is okay. It's okay. It's okay. It's not a problem. That this charity thing is always anybody come or any they want to build something or I think when they come we give. Then during Raya, Korban time, sometimes we give few cows. Yeah, we practice all these things. So, and I feel nice. I feel happy.
Yeah.
I feel happy, to see them. Sometimes during the Ramadan time we have programs. We have a lot of programs during Ramadan time. Ramadan time they will fix all the programs. What are the things and where to give and everything. My team will actually do all those things.
Interesting though, because I read this book called about Barakah Effect, and whatever you said is exactly what the author mentioned in the book, that when you create a Barakah Effect to your surroundings, your business eventually will flourish.
Definitely. And the first thing that we take care is, of course, the relatives is first, but after that is my own stuff. My own stuff is what we take care, whatever they need. We give it to them. We see the criteria and then we give it to them. And then sometimes they want loan and those things. So, we give. Of course, no interest, nothing. It's just whatever you take, you pay back after this thing. And if the family members are sick, that is all taken care by the department. They will look into all this.
Last question, Datuk, before we wrap it up. What's something most people don't know about you?
Well, I am single-handed. I'm alone. I am alone in the sense that I developed this business today is by myself. Nobody supported me. No bank support me. No organization support me. Unlike you see a lot of, right now you've got so many big companies and all those things. This is all by myself. And I learned this from my own experience. I listen to a lot of talks. I listen to, and sometimes I'll do a lot of chairing in a meeting as well, medical meetings. But I listen to a lot of talks. I sleep very late. Even today, I sleep. Yesterday, I slept at 2 a.m. I listen to talks. Even today, I read a lot of books. I listen to talks, and sometimes I get an idea, and I've got a doctor's group, and I will just put it around 1 o'clock, 2 o'clock in the morning, because I takut I lupa on the next day. I just put. So, I am always available, and I keep myself updated. And I think that's very, very important. And not many know about me. If you talk about like Medivaron, Alamedi, Care Clinic, these are all the bigger chains. Bigger chain. But I'm myself. I'm alone. I'm not nobody. No bank behind me. I'm myself.
Well, it has been an honor to have a discussion with you, Datuk.
Thank you very much.
Thank you for your time and thank you for your insight and wisdom. And I hope all of our listeners will get a benefit from this discussion.
Thank you, Aizat. Thank you very much for calling me. Thank you.
Alright.
Okay. Wow.
Berapa lama?